This is a pulse oximeter, and there are various other types and models available in the market, where I got one already. The main features of this pulse oximeter is to find perfusion index, heart rate measurement and blood oxygen measurement. There is also a user manual provided with this. The SpO2 gives the blood oxygen saturation rate, whereas the PR BPM gives us the pulse rate, that is beats per minute. The PI gives the perfusion index rate, and it also has a battery indication symbol. It has a wide rubber finger pad and also a clip that helps us to attach our finger. The measurement principle of this oximeter is based on the spectral characteristics of hemoglobin and oxyhemoglobin with different absorption rates in the red and infrared light areas. This uses an empirical formula of Beer-Lambert's law. The working principle of the instrument is to use photoelectric blood oxygen detection technology. Two different wavelengths of light, 660 nm and 940 nm, are used to irradiate the fingernail of the human body. Through the absorption perspective clip sensor, the measurement signal is obtained from the photosensitive element. The obtained information is displayed on the electronic circuit using the microprocessor. Bone, cell tissues and vein vessels all have different absorption constant of light. When the artery pulsates with the heart's contraction and relaxation, the absorption of light will be different with the increase and decrease in the blood flow. The absorptivity of different light during the decrease and contraction of heart is transformed into measurement results of blood oxygen saturation. This measurement is the oxygen saturation. Let's now see how to use an oximeter. For women, it is advisable to remove nail polish from their fingernails before putting their fingers inside the oximeter. If your hands are cold, you should warm them by rubbing against each other. Take a rest for minimum 5 minutes prior to taking the measurement. Before taking a reading, rest your hand on your chest at heart level and hold it still. Now, switch on the pulse oximeter and place it either on the index finger or the middle finger. The display reading may fluctuate at the beginning, so have patience and be stable. It is strongly recommended to keep the pulse oximeter in a place for at least a minute or longer if the reading is constantly fluctuating. Note the results that is highest once it remains constant at least for 5 seconds. Now record each reading with the utmost attention. Ideally, you should start tracking from the baseline and record at least 3 times a day to keep constant monitoring. The constant tracking of oxygen levels is highly important for the current pandemic.